Americans are being urged to get colon cancer screenings earlier than what they may expect. Dr. George Chang is chair of colon and rectal surgery at MD Anderson Cancer Center, joining us live this morning to talk about the new recommendations. I think it's so important for us all to realize experts are now saying start at age 45 rather than 50. Why that change?
Hi, good morning. Well, there has been a epidemic of colorectal cancer among young adults. In fact, the incidence of colorectal cancer has been dramatically rising. And while we've been making great progress in patients who are over the typical screening age of 50, this incidence has been rising among the younger adults. And so it's in recognition of this that the screening guidelines have been changed.
Well, it's incredible that we are able to do something about this disease, and that is to get it in the pre-cancer stages, and that's why those screenings are so important. So we always say early detection is the key, but it certainly is for colon cancer, isn't it?
Absolutely. Colon cancer is one of the unique diseases where we actually can identify a precursor lesion that we can treat and prevent. It's not just about early detection, it's actually about preventing the onset of cancer in the first place.
Well, we know there are all types of screenings for this, everything from a stool-based test you can do in the comforts of home or going in for that colonoscopy. Do you still feel like the colonoscopy is a gold standard for this, or do you feel like the other tests are okay?
It is. Colonoscopy is the gold standard. It is the test that allows us to most accurately identify cancers and also the polyps that may ultimately lead to cancer, and also treat them and in order to prevent them from ever developing cancer. But the most important thing, however, is that we do get screened, whatever the modality may be, whether it be colonoscopy or one of the stool-based or tests. The most important message really is to get screened.
All right, we mentioned that 45 is now the new number everyone needs to remember as far as age is concerned. But once you get that first test, how often do you suggest someone continue to be screened from there on out through the rest of their life?
It's an excellent question, and you should discuss this with your doctor once the screening test is performed. But it depends on what's identified. After a completely normal test, the next test should be in the next 5 to 10 years. But if a polyp is identified, then depending on the characteristics of that polyp, then the next test may be as soon as the next year.
In a perfect world, someone goes and gets screened before they have any signs or symptoms of colon cancer, but you know we don't live in a perfect world. So let's talk about what those signs and symptoms, warning signs would be that they could possibly have colon cancer.
Yes, well, it can present in a variety of different ways, but one of the most common is blood in the stool. So if you identify blood in your stool, then you should seek medical care. Other symptoms may include changes in your bowel habits, abdominal pain that it doesn't have other explanation. Those are some of the main symptoms that one may experience.
Unfortunately, these are very difficult things to talk about, and people can be embarrassed about that and delay just week after week, month after month, and sometimes even for years. I've interviewed patients who said they just didn't want to go tell their doctor that. How open do you want them to be to realizing that that's what you all are there for, to help them, and that it's okay to talk about it?
Absolutely. You know, this is a difficult topic, and in fact, it leads to long delays, and these delays are even more common among our young adults. And so, absolutely, we want people to be open. You know, while it may feel a little bit uncomfortable to have some of these conversations, it's a lot less uncomfortable than being diagnosed with colorectal cancer.
You are so right about that. Dr. Chang, I feel like conversations you and I are having today could be real lifesavers, and I'm glad you took that time from MD Anderson to talk to us. Thank you for that.
Thank you so much.